In just 16 minutes, Cynthia's life changed forever. In 2023, she experienced many life-threatening medical emergencies. Now, as a professional speaker, she shares her compelling story from a patient's perspective, weaving in messages that articulate how decisions create ripple effects far beyond the life of the decision maker. Before dedicating herself to a professional speaking, Cynthia built a successful 30-plus year banking career, working with everyone from frontline employees to business owners and CEOs. In 2017, she launched Adiku Consulting, where she partnered with companies and individuals to increase the revenue by creating a customer-focused sales culture. Cynthia is also currently writing a book which will share not only her personal story, but also her compilation of inspiring accounts from others who've experienced life changing moments. I met Cynthia through our web designer, and I was very struck by her story. EMS literally saved her life. And although they were medical incidents that brought her to EMS saving her life, it was controlling the bleeding and the communication that EMS made with her. She has a striking story to tell, and EMTs are not people who get uh, um, pats on the back for what they do, but tonight you will. Cynthia, thank you so much for being here.
Thank you for inviting me. I'm thrilled to be able to share my story with you guys and appreciate you taking the time to do it. My first message is when you change the way you look at things, the things you look at change. And if you'll stop and think about that for a minute, apply it in your mind, think about some things that maybe if you looked at differently would change your world. When my husband and I first got married, we didn't want children. We actually said we don't like kids, and I still say I don't do well with OPK, other people's kids. But the timeline changed. We realized we wanted to have a family, and by the time we had been married 12 years, God blessed us with a son. Just 5 months after my son was born, my doctor found that my mitral valve had ruptured and I needed open heart surgery to correct it. So here I was, having gotten my husband to agree to having a child, and I faced a surgery that at that point in time had a 50% chance of survival. You can tell I survived. Everything went well thanks to our prayers and the right medical team. So I continued with my career. I was a working mom. And as Mary just said, I had a banking career, sales consulting business. I started in 2017. And just a few months after I started my company, I was having dinner home alone. I'd stopped working. I'm a workaholic. I swallowed and something didn't feel right. I knew it wasn't right. I called 911. Ambulance came to get me, took me to a hospital, um, just a couple of minutes away, where they kept me for 3 days, ran all sorts of tests, released me after 3 days and said they couldn't find anything that was wrong with me. But I still felt really bad. And at that point in time, I didn't have an internist. I just had a cardiologist. So I thought, well, how you don't just pick up the phone and say, who do I call? So I posted on Facebook. I said, well, everybody posts on Facebook, pictures of their grandkids, their vacation. So I posted on Facebook, does anybody know a good internist? I need somebody. So picked the doctor that had the most referrals. He was able to get me in the next day after they heard what had taken place. I told him my story, what had happened, how I was feeling. He sat back and he listened. And he said, I'm going to order a CT scan. Best friend took me, had the CT scan done, and when I tell you, I did not pull back in my driveway before the radiologist called and said, "Get to the emergency room now." Got to the emergency room, they did another CT scan and confirmed I had an aortic dissection. Had to repair it before it killed me. So we asked the doctor, "Listen, don't take this personally, but we don't know you or your reputation. Could you just let us wrap our heads around this? Can we take care of this in the morning? Can we just do this tomorrow morning? Give us some time." And he looked at me and he said, "You won't survive until tomorrow morning." So there they roll me into the emergency room, and they put in a new aorta, had to replace my aorta. I say, "I have a tissue valve. I will not call it a pig valve." I refuse to do that. So and I don't know why y'all don't judge my husband. My husband takes a picture history of my medical adventures. So this is me after he left. And I have to tell you, my family and friends sat there in that waiting room for 9.5 hours. 9.5 hours, that's a long, long time to not know if your loved one is going to survive. Imagine that. You know, we always see it from the different person's perspective. I didn't know. I didn't look. You can tell I didn't know what was taking place. This is what I looked like when he left me about 1:30 in the morning. This is what I looked like when he came back into my room the next morning, about 7 hours later. My doctor, my internist, comes into the room. He must have had the day off. He's got the baseball cap on, the t-shirt and the shorts, and he comes into my room. And naturally, my eyes filled up with tears. And I'm like, "Thank you, thank you. You saved my life." And he looks at me and he says, "You know, when you came into my office the other day, and you told me what was taking place, I sat there and I thought, should I order a CT scan or should I order an ultrasound?" I ordered a CT scan. The ultrasound wouldn't have caught the damage. The story could quite possibly been completely different. So my first message I have right here is it's okay to ask for help. I didn't have the name of an internist. I asked for help. So many people, whether it's at home or at work, are afraid to ask for help because it's a sign of weakness or it's a sign that you don't know what you're doing. And in your field of work, yes, you have a tremendous amount of knowledge, and every year you increase the amount of knowledge you have. So, on top of all that, things are changing so rapidly. But it's okay to stop here and there and say, "I need some help. Can you help me understand this? Explain this to me. I need some help at home, in your personal life, or at work." Had I not asked for help, my story would be completely different. The second message is we have to be fully present and actively listening. Think about it. It's so easy for us to get distracted. And I'm hoping right now that you're not distracted. It's so easy to get distracted and not get the whole story. I remember when I was in banking, if I was talking to a prospect or a customer and they said something that I knew that I was going to be able to solve their problem based on what they just told me, my mind would go over here because I'm thinking, "Oh, I need to remember to tell them that they're having this particular issue. And I know my service can fix that issue for them." And all of a sudden I would catch myself And by now I'd missed the additional information that prospect or customer was sharing with me because I wasn't fully present and actively listening. The doctors and the team at the first hospital where they kept me for 3 days and discharged me weren't fully present and actively listening, and they almost cost me my life. So for the next 4 years, I had a lot going on. Several months after my emergency surgery, my surgeon in a scan realized that there was one teeny tiny little stitch where they had put in my new valve that didn't heal properly and had created a pseudoaneurysm. He wasn't too concerned about it at that point. He said, "We're just going to continue to watch it. Everything's fine right now." Time goes on, a couple of years pass by. All of a sudden, now I've developed AFib. I have AFib and I have a pseudoaneurysm. So they've tried over about a 2-year period, they tried different procedures to either get me out of AFib or to close up the pseudoaneurysm. None of them worked. None of them were successful. And in 3 of these procedures that they did, they went in through my groin to get through my femoral artery to do what it was that they had to do. I'm not the medical person. My husband remembers all this much better than I do. But they went through my groin on 3 different occasions. My surgeon continued to watch the pseudoaneurysm grow. Gets to the point now and he says, I'm not confident. I'm not comfortable with the size of the pseudoaneurysm. I think we need to go in and repair it. So now he's talking about a third open heart surgery would have been for me in my world. And what I've learned through all of my medical experiences is that, and you guys know, is that these surgeons specialize in one particular surgery or procedure so that they can be the very best at what it is that they do. So my surgeon who had who replaced my valve says, "But I don't do repair surgeries like this. But I have a surgeon on my team who does. He's here today. Let me bring him in and introduce you." And when I'm telling you, when the doctor walks into the room, he looked like Keith Richards from the Rolling Stones. As if that wasn't enough, he starts to describe what it was that he was going to do. He was going to go in here. He was going to crack my chest open first for the third time. He was going to go in here. He was going to reroute this. He was going to go around there. It was very complicated. I said, "Listen, sounds like a pretty complicated procedure. How many of these have you done?" And he goes, "Well, I've done a lot of very similar surgeries, but I've never done one like this." Now, what you want to hear from the guy who wants to crack your chest open. Well, when my surgeon had recommended Keith Richards to do the surgery for me, he said that he had studied over with the specialists in Houston, Baylor St. Luke's Hospital. So I started doing some research on them, was able to get an appointment with them, specialists, nationally recognized surgeons. They said after another CT scan, they said that they believed that they could go in and repair my pseudoaneurysm without needing to do another open heart surgery. He brings in a doctor who specializes in this particular procedure. The doctor comes into the room first. After the brief introductions, he says, "I need to first tell you that I believe in God. I am not the healer. He is the healer. He just uses my hands to do his work." He proceeds to explain he's going to go through my groin, implant a very small device where the pseudoaneurysm is, expects that the scar tissue will build up around that device, and within 6 months to a year, it should all be sealed off. Simple procedure. Did it a few weeks later, stayed overnight, everything's fine, went home the next day. Everything's fine for about 2 weeks. In about 2 weeks, I start to feel really bad. The area starts to hurt, feels really bad. My doctor said, go to the ER, have them take a look at it. They did, and they said, it's a hematoma, nothing to worry about. Go back home. Still feel really bad. And now the area in my groin where they had gone in to implant this device started bleeding. Each day the bleeding increased a bit. I was very sore. The bleeding started to get worse and worse. Now it's about 4 weeks after I'd had that procedure done, and I woke up one morning and I was bleeding profusely. Now, it had been 4 weeks. My husband had been trying, as the bleeding started to progress during this time, my husband had wrapped bandages, taping this up here, gauze, doing everything because the bleeding increased. Well, y'all, this morning I wake up and we could not stop the bleeding. It was it was scary, quite frankly. So he realizes we can't get it to stop. He calls 911. Ambulance comes in, and when I tell you the look on the paramedic's face who got me from my house, I still remember it. Um, it was kind of the look, and this is your world. You may have had cases like this, I'm sure, where you had a similar experience. The look on their face when they got me and I was bleeding so profusely was sort of like, oh my gosh, what are we going to do with this? They get me to the emergency room, and the ER doctor there recognizes the severity of the situation. I don't have a hematoma like they told me. I had a pseudoaneurysm in my femoral artery. I have a high level for pain. I was screaming. The nurses were running around with the doctor trying to keep the bleeding down. They had sandbags. They had to start a blood transfusion. I was bleeding so intensely. My husband said that you could actually see the artery protruding from where I was bleeding. It had opened up. He said you could see the artery protruding, that the bleeding was so much. Well, the ER doctor recognized that he did not have the specialty vascular surgical team to repair my femoral artery. So he called ahead to another hospital that's about 35 miles away from where we were at this hospital, was able to confirm that they had a specialty vascular surgical team over there, and they were available. It's about 5:30 in the morning, and I know y'all work 24/7. They were available to get together to do my surgery. Well, my ER doctor recognizes as well, they can't wait to get me 35 miles away. I would bleed to death. So he calls in a medevac to transport me. Now, by now, one of my sisters has come into the emergency room. We're waiting. I'm screaming. They're trying to keep the bleeding under control. My sister comes in and she says, Cynthia, you're going to get to ride in a helicopter, which was not exactly the way I wanted to get to ride in a helicopter. My ride gets there. My helicopter gets there. And when I tell you, they put me on the stretcher and they took me to the door to take me out for the helicopter ride. And there's my paramedics, Brandon and Jean. And from the moment I met them, they were in control. And I wasn't. They were in control. I'm Brandon. I'm Jean. We got you, Cynthia. We're going to take care with you. Stay with me. Stay with me, Cynthia. Just come on, stay with me. They put me on the helicopter. I couldn't tell you what the inside of that helicopter looked like. I was screaming. I was bleeding. Brandon and Jean, the whole time, they kept saying, stay with me, Cynthia, stay with me. And I'm thinking, I don't get it. Now that it's all over, I understand. I'm thinking, where the heck do they think I'm going to go? Stay with them what? Where am I going to go? Brandon is a solid guy. He's not fat. He's solid. Weighs, I don't know, 225 pounds or more. He has a sandbag in my groin, and he's got his knee pressed into the sandbag with all his everything he's got. Jean is pressing as much as she can with her hand. And I still have the blood transfusion because I am bleeding. The bleeding is profuse. It was a horrible, horrible moment. Not one of not one of my better moments. It was, and all of a sudden, they're still stay with me thing. They're doing whatever they have to do to keep me from bleeding to death. And all of a sudden, Brand says, what's your favorite color, Cynthia? Tell me, what's your favorite color? I just ignored him. I'm thinking, really? Come on, Cynthia, stay with me, stay with me. What's your favorite color? And I replied with some expletives that I know was completely inappropriate. Come on, Cynthia, tell me what's your favorite color? Mine's orange. What's your favorite color? What is it? Come on, Cynthia, tell me. And I'm like, you don't care what my favorite color is, but it's purple. What I didn't realize was by then my artery had ruptured and the bleeding was intense. The ER doctor, as I look back at the records, the ER doctor had written that I had intense and explosive bleeding. And I kept thinking the pain was it was excruciating. The pain was so intolerable. And I thought to myself, if I could just close my eyes and go to sleep, I won't feel the pain. I'm going to close my eyes and go to sleep. I'll wake up when they've got it under control. I'll wake up when they get me to the operating room. Something told me not to close my eyes. That helicopter pilot, when I got on the helicopter, recognized how severe the situation was. And I don't know if Brandon and Jean, bless them, they had total control. I don't know if they said anything to him, but he radioed over to the air traffic controller, who was able to get some of the other air traffic in the area diverted to expedite our arrival at the other hospital. They got us from one hospital to the next, more than 30 miles away, in just 16 minutes. Just 16 minutes. Brandon said it was the longest 16 minutes of his life. Felt like 2 hours to me, but it was just 16 minutes. Now, I know when they got me to the hospital, and believe it or not, this hospital, major hospital in our area, didn't have a helipad, if that's the right way you say it, on the top of the hospital. We had to land across the street, across the highway. They put me, Brandon and Jean are still there the whole time, keeping the bleeding under control. I don't know how they did it. They were there the whole time, got me in the ambulance, transporting me over across the highway to the emergency room so that they could get me into the operating room. I know my husband was able to get Jean and Brandon's contact information before they left us. I don't know. I was rolled into the operating room, but we were able to keep in touch with him afterwards, but John said that when they got me there to the hospital and Jean and Brandon were there, she was yelling orders to the people in the emergency room. They were there ready for me. They had already prepped the operating room, telling them what had happened, what they had done to keep me, what to do with the bleeding, where we all were. She had it under control. That 16 minutes, though, I coined the phrase 16 minutes from that and consider it to be a pivotal event that leads to a life-changing decision. And we don't just have one 16-minute moment in our lives. You can have several. That day, the people who were involved in saving my life, they made life-changing decisions that saved my life. The ER doctor knew he didn't have the vascular surgical team. He got one set up. Knew that he had to get me over there as fast as possible. Got the helicopter pilot. Got me Brandon and Jean. Brandon and Jean knew everything they needed to do to get me from one hospital to the next without bleeding to death. My pivotal moment, my 16-minute moment that day was when I decided not to close my eyes, because I realized it would have been for the last time, that God gave me the strength not to close my eyes. So they got me there to the hospital. They get me into surgery. Took them 4.5 hours. I don't know why, y'all, but my husband takes pictures of my adventure. So this is me after my femoral artery repair surgery. Reading the doctor's notes about the intense and explosive bleeding, looked back and they said I had lost from one hospital to the operating room. I had lost 37 ounces of blood. I looked it up. That's about 20, and y'all probably know it's about 25% of the blood in my body. I can't imagine how much more blood it would have been had I not had Brandon and Jean there to help me. I remember Jean saying they were alternating or combining efforts. She said, I had so much pressure on you. It was so hard for me to keep the pressure on. I didn't know how much longer I would be able to do it. But I had seen your family in the waiting room. I saw your family as they came out when we put you in the helicopter. I saw your family and I thought, I knew what would happen if we didn't keep the pressure on. I knew what would happen, and I couldn't do that to your family. Everything went fine. The surgery went fine. It sent me home 4 days later. Sent me home with a home health nurse to treat my wound. Every few days, she would come in and do a washout procedure. And now it's about 11 days after my surgery, and she sees that I've developed 103-degree fever. Another ambulance ride to the hospital where they told me I had sepsis. Admitted to the hospital once again, and they have me on IVs of blood thinner and antibiotics, trying to keep the sepsis under control. So every couple of days, they had to do a surgical washout procedure to where the wound was, to keep the sepsis under control, try to treat it. It was after about the second or third washout procedure when the last thing I remember saying was telling the nurse that I had a horrible, horrible headache. And the next thing I know was I woke up with half of my head shaved, staples in my head, and my head was wrapped with bandages. I had developed a brain bleed and had to have emergency open, it's on the brain, emergency brain surgery to release the pool of blood. And that's not one of my better hairstyles there. So this is me the day after my brain surgery. Once again, he documents my adventures. And we could pray by now. It had been quite an adventure, and I call it my medical adventure. Been quite an adventure. We had people praying for us all over the country. My family and my friends were praying here. Their family and friends were praying everywhere. We could honestly could feel the power of prayer. And that's what got us through that adventure, that adventure. So I stayed in the hospital for 2 more weeks where I had a total of 7 surgeries. I had 5 surgical washout procedures to make sure that I wasn't septic any longer. I had the brain surgery to clear up the bleed, pooled blood, and then when they were certain I wasn't septic any longer, I had a surgery where they created a bypass for my femoral artery, did as much repair as they could to my muscles from all the damage done. And then they did some plastic surgery to take a piece of skin from my thigh and put it where they had done all the surgery for the repair. I have to tell you that at no point in this time, at no point in the helicopter with Brandon and Jean during all the procedures, I was never afraid of dying. I never feared dying. They discharged me, they said, after 2 weeks, they said, we're going to discharge you. I was so excited. They said, oh, no, no, you don't get to go home. You've had too much trauma to your brain and your body. I went to 5 weeks, got to stay for 5 weeks in a medical rehab hospital. They had to teach me pretty much, get me back to walking again, talking in a manner that people could understand me, and physical therapy to be able to lift my leg, and speech therapy and occupational therapy. That's what it was. I couldn't I couldn't read a clock. I didn't know much of the alphabet. I couldn't sign my name. But every single therapist, look, you see the look on my face, how excited I am about being there. Remember the doctor coming in, and after a few weeks, I'm like, okay, is today the day I get to go home? No. Every single therapist that I worked with, every therapist told me it was so nice to work with a patient who wanted to get better and who would do what it took to get better. Some people, so many people she said they worked with would do just enough to get by. What I knew was I knew where I wanted to be, what I wanted to be, and that I was going to do whatever it took to get there. We all know people like that, people who are perfectly content doing just enough to get by. We all know people like that. Maybe they're miserable in their job, but they get up every day and go to work and they share their miserable attitude with their coworkers or their customer because they're willing to do just enough to get by. I decided I wasn't going to do just enough to get by. People don't realize, I think, that they're doing it when they do it. We probably know some people, and maybe you're one of those people, I don't know. We know some people who argue all the time, maybe couples who argue all the time, and maybe it's over money, finances, but they don't take the time to sit down and make a budget because they're content doing just enough to get by. See, what happens is if nothing changes, nothing changes. You have to make a plan, put your mind to it, that you're going to be where you want to be. Finally, after 5 weeks at the medical rehab hospital, I got out of lockup. That's what I call it, lockup. Appreciate going home, people. It's not, being home, my husband said he could immediately see the change, the progression in my healing after I got home. So this is us celebrating in the driveway with our glass of wine. We were able, about a year after my lockup, about a year after I was released from lockup, we were able to get together with my EMT saviors, Brandon and Jean, and to go to dinner with them. And during that dinner, we were each able to tell our stories. A lot of it, as you can imagine, and you've experienced with your patients, a lot of it I do not remember because I was in and out of it. The stories they were telling me, the things that happened on that helicopter, the thing, Jean's the one who told me when we finally got to the emergency room at the other hospital, she was the one who was telling me, she was telling them what they needed to do to take care of me. It was amazing. Brandon and Jean, to this day, my vascular surgeon, every time I see him, says Brandon and Jean saved my life. They saved my life. Every time I see him, he tells me that. I still get to stay in touch with these wonderful people. And thanks to Brandon and Jean saving my life on that helicopter, I got to celebrate my 40th wedding anniversary this year. And I got to spend my 27th Mother's Day with my son. Every day is a gift. And I think so often we forget that. That day on the helicopter could have been my last day. Gives you a whole new perspective on every day is a gift. Think about your 16-minute moments when you make those decisions that are life-changing, not just for you so often. They're not just life-changing for you. They have ripple effects. And think about the impact of the decisions you make and the actions you take during your 16-minute moment.
Cynthia, thank you so much. EMTs again so rarely get to hear the impact that they have, and what they mean to with the process of patient continuum, much less from the patient themselves. And so we appreciate your being here tonight to share that story.
And
Um,
Mary, if I may, because that's one opportunity, pardon me for interrupting, that's one opportunity when we were at dinner with Brandon and Jean, and it was about a year, like I said, after my release. And I was telling them the story. And Brandon said that he said, it's so nice to
yeah.
be able to hear it from the patient. We never get it from the patient's perspective. We rarely get to find out what happened with the patient after it's happened, unless they weren't able to help that patient, if you will. But as they said, you've got to share your story. You've got to tell other people. You need to tell EMTs what your experience is and what we can do for you. We don't hear about it from the patient's perspective. So for us to be able to break bread with them and to get to hear each other's story. He invited me and I got to speak at their medical conference last year, their EMT, their medical emergency services conference last year. And it was a wonderful experience. So yes, I know you guys don't get to hear it. And that's why I feel so blessed to be able to share it with people so that you understand. We think you're wonderful.
Certainly, thank you for sharing your experience with us, and it's a valid point, um, and something that EMS needs to work on is we don't get follow up to the patients that we pick up. You can be on a small community service, or you can be on a service that sees 50 patients a day. Um, but your time with them is 5 to 20 minutes, whatever your response and treatment times are, and then you never see that person again, unless it is somebody in your community, and then you see them on the street. And actually, in my personal EMS experiences, those were completely incidental things where people just ran into me at the laundromat or at the grocery store. Otherwise, I would have never found out what happened to any of these people years later. So it's a valid point. If you do have a personal experience with EMS, uh, to take it for granted that they have no idea what happens after they do the job, and they would like to know how you did. So I appreciate that.
Thank you. Thank you for being here, Cynthia. And to get for more information on, I had put it in the chat box for more information on Cynthia and her story, and her the book that she's working on, 16minutes.com. And then go ahead. Sorry, Will.
I was going to say, and remember, the McSwain Trauma Education Project is totally dependent on our audience and our supporters to be able to continue the work that we do, whether it's these third Thursday talks, which again, if it's the third Thursday of the month and it's 8 o'clock Central Time, we're here. It's a different topic every month. We've got speakers from all over the world that have participated. So join us, 8 p.m. Chicago time, New Orleans time, Ames, Iowa time. So it's central part of the country. It's 8 p.m. in the central part of the country. We're here the third Thursday of every month. So join us. Also, speak up. Let us know topics that you'd like us to address. Suggest speakers that you think that we should all hear from. We are completely adaptable and absorb it in that sense that, whatever comes to us, we're going to take an opportunity to use it and to make sure that we share. So whether you're taking the opportunity to give the charity a couple of bucks so that we can continue to do the work that we do, or whether you bring in us a topic or a place that we might be able to bring the traveling McSwain Trauma Education Project Roadshow to. All of this is what we do. All of this is dependent on the interaction with our providers. The audience that Cynthia is trying to address tonight, to say thanks for the work that you do. And we're just trying to say thank you too, in a sense, by bringing you all the tools that we can bring. So look at the website, join us the third Thursday of every month, send us your money or your thoughts, and we will continue to do the work.